everyone, welcome back to Clinical Psychology Community UK. My name is Holly, I'm currently a trainee clinical psychologist on my first year of a course in the UK. Today we're going to be talking about the most requested topic I've ever had. I always ask on Instagram and Facebook, I ask people to let me know what they want to see, and on YouTube as well, so pop down in the comments any content that you'd like me to cover about psychology. Tends to be clinical psychology and the doctorate courses in the UK, but very happy to look at broad psychology as well. So let me know what you want to see. Today, we are going to be looking at linking theory and practice in clinical psychology. As I say, hugely requested topic. I can't tell you how many times people have asked for this. And today I'm going to go really, really broad and quite brief into the basic principles behind theory and practice. So this is not an exhaustive list of different ways that theory and practice can be linked, but it might give you a bit of a general idea. So today I'm going to talk through some definitions of theory and practice. I'm going to talk about how we bridge the gap between theory and practice and how they're linked, and in different types of practice. So clinical, research, reflective, and I'm also going to give you some tips as well. So let's start with some definitions then. Okay, so theory then is a set of ideas aiming to explain some aspect of the human experience, and quite often, very much in modern psychology, it's a lot about thoughts and behaviour and how those interact. So in terms of the CBT model, the CBT theory. And then we've also got models of learning and models of development and ageing as well. Lots of different theories to explain why things happen. In terms of practice, broadly working in psychology, and I've split this up into 3 different sections, and there are lots more things. This is quite a simplified way of looking at it. There are lots more ways that people can work in psychology. So firstly, research, which would be exploring the human experience, could be, again, cognitions, memory, attention, thoughts, behaviour, the things that we do. Internal processes could be, again, those kind of things that we are thinking, our attachment, those sorts of things, that we're looking at the human experience. In terms of clinically, so working with clients, and that could be in terms of assessment and or intervention, and often part of a multidisciplinary team. There will be a video coming out really soon talking about multidisciplinary teams, the pros and cons, and why we work in them. And reflective, so this is just thinking about your experiences. The original reason I started the channel was to talk about reflective practice. So there's loads of videos that I've done. I'll make sure I link down below in the description. So those are the definitions of theory and practice that we're kind of working with. Before we move on, the reason that we talk about theory and practice in clinical psychology is because these are like the fundamental kind of building blocks, I suppose, of psychology, of our whole discipline. So theories are kind of like the fundamental, and practice kind of stems from that. So it might be that a theory is developed. We will talk a little bit more about this when we come on to research. A theory is developed, and then perhaps an intervention might be designed due to that theory, based on that theory. That intervention is then researched and found to be effective, hopefully, and then it would be used in clinical practice and everyday practice. So that's kind of the very simplified route of CBT and lots of other kind of therapies and interventions. But let's move on to research practice. So in terms of research practice, research is an essential part of clinical psychology practice. Okay, this is a huge part of it, and I think particularly on our course, it's a postgraduate research course now. It used to be a postgraduate talk, but now it's postgraduate research. And the research is hugely important, and what they want to be doing is not just training therapists and not just training, clinical psychologists. They want to also be training kind of researchers, or certainly psychologists that can do research within NHS settings. Research provides us with an evidence base for clinical practice. Theories are developed and tested. So what we mean, you might have heard evidence base, literature base, you might have heard all of that. And basically the evidence base is what evidence is out there, what research has been done that kind of supports something, basically. So like, I'm going to refer to CBT a lot because it's a very well-known and well implemented theory and model in therapy. So CBT has got a huge evidence base for lots of different reasons. Lots of funding went towards CBT for lots of different kind of presentations. It's quite formulaic, so people like that. You can teach it quite well. But it has got a good evidence base, and we are bound to make sure that we have an evidence base behind the interventions that we're delivering to people. It's what the NICE guidelines are. You know, they are evidence-based guidelines. So they're based on the research that's already been done to say, yes, this research has found that this is effective, so we can use it in practice. Interventions are developed and tested based on a theory. Interventions are then used in clinical practice if they're evidence-based. So that's kind of, again, very, very simplified, reductive route of kind of how research goes into practice. Helps with clinical practice. In terms of research history, well, you can't really talk about research in psychology without kind of talking a little bit about some of this. So research has not always had the ethical standards that it has now. There's lots of historic psychology experiments that have provided us with lots of very key theories in psychology, but certainly would not be repeated now because of ethics. I've only chosen 2 here, but there are lots of other ones as well out there. So, for example, Little Albert in the 1920s. So this kind of contributed towards what we understand about behaviourism and classical conditioning. So Little Albert was a child and he was conditioned into being frightened of rats by being subjected to kind of loud, scary noises when interacting with a rat, which he previously did not fear. Ethically, that wouldn't really be allowed now, but it has proved the theory that we can condition people into having kind of fear responses. So kind of similar. So the Bobo doll experiments is kind of a series of experiments demonstrating that children will act aggressively towards a doll when they witness adults doing the same. And this is kind of about social learning theory, happened in the 60s, early 60s. Again, wouldn't necessarily be the way that we do things now. It might not be that we're trying to mimic aggression. It might be that we're trying to mimic compassion, because that's a much easier, and a much more ethical way of doing things. But we do know about social learning theory because of these experiments. In terms of research practice, I just want to say that I'm not a researcher. I know what I've said. I'm on a postgraduate research course, but research still scares the bejesus out of me. But here are some kind of fundamental things about linking theory and practice in research. So firstly is understanding what the existing literature is, like what's the topic you're really interested in that you want to research. Okay, well, see what's out there, see what's already been done, what theories are out there, and then think about the gaps in that current research. What needs to be looked at now? So it might be that in some of that research it has suggestions for future studies. Have a look at some of those sections and see, okay, well, is there anything that hasn't been tested within this theory or this model? Is there any different population or presentation that I could kind of test this out with? Or do any theories need further exploration or development? Perhaps in a new population or presentation, as I say. So you might be thinking, oh, actually, it works well with this kind of client group that I've worked with, but what about this? Let's go and test it out with this kind of client group or this presentation. Just some ideas. But also, and any of these tips, if you're doing research, you're not going to be doing research on your own. You will be working with supervisors, you will be working with colleagues, so make sure you're talking to them as well. That's really best practice, is working as a team. So moving on to clinical practice, which is arguably one of the things that people are most interested in psychology about, possibly. From my experience of speaking to lots of people, research tends to be quite a scary thing for a lot of people, whereas clinical practice seems to be what people are more interested in. So in terms of clinical practice, clinical psychologists work in a range of ways clinically. So it could be in terms of assessment, it might be neuropsychological assessment, diagnostic, could be general kind of clinical interview, could be interventions that they're doing. So quite often that is therapy. That's certainly at my level of training, that's kind of the focus for us right now, is very much on the therapy side of things, because we need to develop those therapeutic skills. And that could be in terms of group work or individual work. And there's also consultation with MDTs, so multidisciplinary teams. How do we bridge the gap then between theory and practice? Well, you could conceptualize it like this, with theory on one side and practice on the other, with a line in the middle. How do we bridge that gap? And quite often we talk about formulation, bridging that gap in clinical practice. So formulation, I have done a video on it, which I will definitely link down below for you. Formulation essentially is a way of bringing that theory, that model of a particular presentation or situation that you're working with to the client. So a formulation is you can kind of conceptualize it as a mind map in some situations, with particular arrows going to particular things. And it can help the client understand what's going on for them based on the theory behind what we think might be going on. Let's think about CBT. So CBT, a very kind of basic formulation for CBT, just general, we'll be thinking about how thoughts, behavior, physical sensations and emotions all kind of interact with each other in a given situation. So you can kind of map that out and think, okay, so let's say you're working with someone with social anxiety, and you might say, well, here's a situation, a triggering situation is that you are required to go to your office Christmas party or whatever. So then you think, okay, so what thoughts are going through your mind when that happens, and what emotions are going through, what emotions are you experiencing when you're dealing with this? And then, okay, do you notice any of that in your body at all? And then what do you do as a result of your thoughts, your emotions and your feelings? What do you do? So that is a way that you can kind of map it out, and that brings that CBT theory that all of those things interact: thoughts, emotions, physical sensations and behavior. And you're applying it to practice, to someone's existence, to someone's presentation. So that's one of the ways that we can kind of bridge the gap, and I would highly recommend watching that formulation video, because I go through different examples of a few different models of formulation so you can kind of understand it a little bit better. But in terms of clinical practice, the gold standard is to work in an evidence-based way. As I say, using the NICE guidelines, all based on the evidence and things. This means that using theories and interventions that have been researched and shown to be effective. And at the moment, as I've said, a lot of that is CBT, particularly for things like OCD, anxiety, depression, potentially trauma, eating disorders. There's a lot of different presentations that CBT has been shown to be effective in. And the evidence base refers to the literature available on the topic. So, as I say, going back to this, yes, absolutely, we can conceptualize it as this, theory on one side and practice on the other, with formulation in the middle, bridging a gap, linking theory to practice. Absolutely, we can. But there's also a couple of other things that connect it. So, looking at evidence-based practice. So, this is doing exactly what we're doing. Okay, so we're looking at, okay, well, we know that this person has social anxiety, and we know that CBT has been shown to be effective for social anxiety, using these techniques for this many sessions, for this many hours a week, with doing this homework and all of this. You can look at it in a very manualized way, and that is evidence-based practice, and you're doing that. That's the link between theory and practice. But there's also something called practice-based evidence. And this is essentially doing the clinical practice, so doing the assessments, or tends to be more the intervention, the therapy, and seeing that it's effective and thinking, okay, well, maybe we could write this up as a case study and publish it, and that could be part of the evidence base that's out there. Case series and case study designs are really useful in terms of practice-based evidence. It might be that you're working with someone that doesn't quite fit the CBT, so maybe you integrate a little bit of ACT or a little bit of compassion focused. So my first placement was in a pain service, and we don't do kind of straightforward CBT as such. It's quite integrative with those other models, which is really helpful for people. But actually thinking about, well, what does that mean in terms of contributing to the evidence? Well, we've done some practice, we've seen that it's been effective for somebody, let's write it up and contribute to the evidence. And actually it might be that we know now from several case studies or case series designs, or even big studies like randomized controlled trials, or big studies that are done with large N numbers. Actually, we might find out that a more integrative approach to chronic pain might be more useful, and then the theory could be looked at because of that practice-based evidence. So there's huge links there in between, and I think if you look at this, yes, absolutely, we've got theory, practice, but actually it kind of is a bit more like a circle. Like all of these lines could go either way, and it's kind of, there's many links between theory and practice in there. Some tips then for clinical practice. So look at the NICE guidelines. If you are working with a particular presentation, if you're working in a particular service like substance misuse or an IAPT service or an older adult service, look at what the NICE guidelines say for that particular presentation and client group. See what actually evidence-based practice is. And you might find that your service is not potentially adhering to those guidelines as such. They are guidelines rather than law, but it's really important to know what those NICE guidelines are to make sure that you are linking theory and practice appropriately. And also what I just recommend is reading key papers for the presentation that you're working with. So a quick lit search can help with that. Just Google Scholar, just have a look for those key terms that you're looking at. For me, I did this when I started my placement, looking at chronic pain and just seeing, okay, well, what therapeutically are some of the things that have been shown to be effective? And that, I think, does help me when I'm in the therapy room. Thirdly, as always, in every situation in psychology, use your supervision. If you're working with someone and you're trying to kind of make a theory fit, you're trying to use CBT, which I have experience trying to put in the teaching that we've had on CBT and think, that doesn't quite go. I don't think the client's quite warming to this approach, or let's think about some more ACT-based stuff and some values-based work. And actually using supervision, you can bounce that off your supervisor and say, look, I'm not quite sure, what's the evidence base for this? What do you think I should do for this? How can I link those things together? That's what they're there for at the end of the day, is to kind of help you make sure that you are delivering that evidence-based practice and to support you in your own development. And fourthly, reflect. Always, as always. I mean, I wouldn't be me without saying, gotta reflect. And I will link in down below some of the reflective model stuff that I've done as well, so you can it will hopefully help. Moving on to reflective practice then. So what is reflective practice? I have done a video on this and I again will link it down below. So essentially I think there's a lot of stuff spoken about reflective practice, but essentially this is the definition. Paying critical attention to the practical values and theories which inform everyday actions by examining practice. This leads to developmental insight. It's a bit wordy, isn't it? Paying critical attention to the practical values and theories. Essentially, you're thinking about an experience that you've had and thinking, okay, well, what happened there? How did I feel in that moment? What was the outcome? How did I feel about that? Is there anything I could have done differently? How was the other person responding? Or if there wasn't another person involved, then just looking at what's going on for you inside. And there are loads of different models of reflection that can help you, but not many encourage reflection, including any relevant theories. So here are some tips. When you're doing reflective practice, you're thinking about how you can best develop and make things better. It's important to reflect not only on the things that didn't go so well, but also the things that did go well. And use a reflective model. There are so many out there, just give a few a go. As I say, I've done some videos on them with some examples, so hopefully that'll help a little bit. Secondly is even if that reflective model doesn't have a section to include a theory, I would try to apply a theory to your reflection. For example, with CBT, think about your thoughts, emotions, bodily sensations and behaviour. Think about what those were doing. Do a little mini formulation or a hot cross bun. Do one of those. Or with ACT, maybe thinking about your values or thinking about the ACT hexaflex at all. That might be interesting. Thirdly, reflect on how you found applying a theory to your reflection. For example, was it easy? Was there anything challenging about it? Was it a particular theory that you tried to apply that didn't sit very well? Like if you tried to think about, okay, I had a difficult situation with a client, I was trying to think about CBT, I was trying to think about what my thoughts, emotions, sensations and behaviour were in that moment, and it just doesn't, things don't seem to fit very neatly in those boxes and I just find it a bit clunky. Well, think about that, think about why, and what does that mean for your clinical practice when you're trying to do these kind of formulations with people? What does that actually mean? If you found that difficult to apply in that situation, how are you going to overcome that when you're trying to do it with a client? It's just important to know how you get on with all these different theories and how you can use that in clinical practice. So those are my tips. In summary, and as I say, this is very, very brief. There's lots of other points that you could make. Theory and practice are two fundamental areas of clinical psychology. They can be linked in various ways. And practice can refer to research, clinical, or reflective practice. This is just an introduction, okay? Let me know what you think in the comments. Let me know if you've got any extra bits that I haven't included that you think might be really helpful. And thank you so much for watching. Make sure that you watch those videos that I've linked down below and also coming up now on your screen, hopefully. Please make sure to subscribe to us on YouTube. Every subscribe massively helps and I appreciate it completely. Let me know if you want to see anything else. Drop me a line in the comments. Thanks, bye.